I take care of a lot of the social issues and the social determinants that affect our senior population. And then I also try to develop programs that either address chronic disease self-management like diabetes and hypertension, and also programs such as the PEARLS, which stands for Program for Encouraging Active and Rewarding Lives. These are all evidence-based programs that we've had staff training, and there's been a lot of research and a lot of into the problem, which is primarily depression, anxiety, loneliness, and social isolation in the above 60 demographic. But basically, we go to the client and we work with the providers, and we're overseen by a clinical psychiatrist. And so we really are just a coach to try and support them in any of these sort of mental health, emotional related issues, and just try to get them back to doing things that they enjoy doing, maybe doing some social things, physical activity, and just learning how not to get so overwhelmed with the issues of life. So that's kind of PEARLS in a nutshell. The people that we have trained here at the health department are a little bit older and mature, and so we make a connection to that client, and we talk about what the program is going to do and get them comfortable with ourselves, because it's going to be the same person who meets with them for 8 weeks, and then we do follow-up for 6 months to a year with the person, and that could possibly be a visit or a phone call. So we go out and we just get to know one another and get to know what the client is dealing with and what things that's overwhelming in their life, or concerns that they have, and then we try to break that down into one thing at a time. You know, the old saying, one day at a time. Well, we do one thing at a time. So, and then just start kind of go through a problem-solving plan on how we can break down that one thing and just make an improvement in that one thing in their life. And a lot of times just taking control of one issue empowers them to be able to go out and feel better and do other things that maybe they stopped doing. We try to help them identify things that they maybe used to do that they just stopped doing, and just try to find some quality of life, some enjoyment in life. We try to get them to do a little bit of physical activity, but pretty much it's the format of a visit is a guidance format, so that the person is, we're just guiding them, and they're actually making these decisions and choosing what they want to do in their life.